Hi students, topic of today's class is plaque control measures in pediatric dentistry. Dental plaque. Dental plaque, you all know what exactly dental plaque is. But in a layman terminology, I can quote a normal day-to-day example. If you leave a mug in a bucket of water overnight, what happens in the early morning? If you touch that mug, you can feel a slippery layer over the mug. That that is a layman example for the dental plaque. In a similar way, in our oral cavity also what happens, this saliva, we can assume it as water, and because it will be bathed continuously, the oral cavity, there is a possibility of formation of a slippery layer which is called as a biofilm over the surface of teeth and other structures. So dental plaque is the main reason for the pathology, not only gingival and periodontal diseases, but also even dental caries is because of this dental plaque. So the main culprit behind every dental problem is dental plaque. So dentists really have to concentrate a lot on this dental plaque. And definition wise, WHO has defined dental plaque as a specific but highly variable structural entity resulting from colonization of microorganisms on tooth surfaces, restorations, or other parts of the oral cavity made of the salivary components like mucin, desquamated epithelial cells, debris, and microorganisms, all embedded in gelatinous extracellular matrix. Seems very complicated, but it's one and the same. A layer will be formed which consists of layer can form on the tooth surfaces, restorations, or other parts of the oral. Wherever it forms, it will be made of the salivary components like mucin. Desquamated epithelial cells will be there, debris will be there, microorganisms will be there, and they all will be embedded in a gel-like extracellular matrix. And in simplified manner, another definition is that the soft deposits that form the biofilm adhering to the tooth surface or other hard surfaces in the oral cavity, including removable and fixed restorations. And how this dental plaque and what is the current role or current hypothesis, which is the theory behind the role of this plaque bacteria in the etiology of dental diseases. For this, many hypotheses have been suggested, and the important ones are the specific plaque hypothesis and the non-specific plaque hypothesis. These are the two hypotheses which run in a different manner, that is totally different. So non-specific plaque hypothesis says that bacteria present in the plaque, actually they are not specific. Any n number of bacteria will be present, and they, if the number of that bacteria increases, that leads to disease. Whereas specific plaque hypothesis says that only specific type of bacteria is leading to the formation of either caries, periodontal problems, or any disease is caused due to only specific bacteria present in the plaque, and other bacteria have no role to play in the disease process. And another thing came, that is ecological plaque hypothesis, which is an updated version which combines the both hypotheses, that is non-specific and specific plaque hypothesis, and it runs like that. The bacteria will be present in the oral cavity, so many bacteria will be present in the oral cavity, and what happens exactly is when the environment changes. Say, for example, if we take more fermentable carbohydrates in our diet, what happens? Automatically, the bacteria starts metabolizing these fermentable carbohydrates, leading to formation of acids, which lead to decrease in the pH of the oral cavity. This decrease in oral cavity pH leads to favors the growth of acidogenic and acidic bacteria, that leads to change in the ecology. So it supports the growth of this acidogenic and acidic bacteria, which lead to formation of dental caries or other disease process is due to the change in the environment leading to or supporting the growth of certain bacteria, certain specific bacteria. Okay, and even this drop in pH, that is drop below the critical pH, also leads to demineralization of the tooth structures. So this ecological clock hypothesis combines both concepts of specific and non-specific clock hypothesis, and it is the acceptable theory behind the role of clock bacteria in etiology of dental diseases. So the key features of this hypothesis runs that the selection of pathogenic bacteria is directly coupled to changes in the environment. So if the environment changes, automatically the pathogenic bacteria will increase, or the environment supports or selects the growth of this pathogenic bacteria. And diseases need not have specific etiology. Any species with relevant traits can contribute to the disease process. And strategies that are consistent with the prevention of dental disease via principles of ecological clock hypothesis, automatically if the theory behind any disease is automatically the strategies to prevent the disease also become also can be standardized. So how can you prevent the dental disease? Based on the psychological clock hypothesis, we can say that we maintaining the environment plays a major role. So environment has to be maintained. So if the environment has to be maintained, automatically the two main factors that come into role are maintenance of oral cavity and then diet. These two play a very major role, which we can handle to prevent the dental diseases like dental caries or the periodontal problems. So first and foremost, plaque control measures. So we can categorize these plaque control measures into either mechanical plaque control measures or chemical plaque control measures. Today I will be telling a few things about mechanical plaque control. In the next class we can go with other things, remaining part of mechanical plaque control and even chemical plaque control measures. So mechanical means anything mechanically you are trying to remove the formed plaque on the tooth surfaces. So first and foremost, which comes to our brain definitely will be toothbrush. So toothbrush is the first mechanical plaque control device that daily or day to day routine has to start with toothbrush and even has to end with toothbrush actually. So coming to the history of toothbrush, quicks of lentics, wood and aromatic quicks were used as brushes in ancient days. Even some villages still today, some people use these quicks as toothbrushes. And gold toothpicks were reported to be used in the year 3000 BC. Chinese fabricated toothbrushes made with bone or ivory fitted with natural hog bristles. What is hog? I think you people know hog is nothing but it's a domesticated pig actually. The natural hog, that hair is used as bristles actually. So were in use in 1600, whereas it was brush exactly was introduced to Western civilization in 18th century and first patented in US in 1857. So first toothbrushes were made with nylon. Made with nylon were introduced in 1938. These are common bits that you might come across during any entrance exam regarding the history of toothbrush. So in which year nylon toothbrushes were introduced exactly in the market. Then when it was introduced to the Western civilization, in which year. So the tufts or the bristle design. Coming to the bristle design, um, these bristles actually they will be grouped in tufts. Actually, these tufts. So single one is the bristle, and these bristles will be made into tufts, and the lot of tufts will be there in the head of a toothbrush. So the bristles are grouped in tufts that are arranged in three or four rows on the toothbrush, and this bristle end is very important. The bristle end should not have any sharp thing or irregularities. It should be rounded. The end should be rounded. That is the exact design. That should be the exact design of a bristle in a toothbrush. Then the diameter of commonly used bristles ranges from 0.007 inch to 0.012 uh, for soft and medium bristles. So mostly in market you will be coming across either soft or medium. Even hard you might see, but hard is not recommended in all the cases. So soft and medium, if the most commonly used things for pedo. If anyone asks about the diameter, it ranges from 0.007 inch for a soft brush and 0.012 inch for a medium bristle. And kids toothbrushes should have thinner, even thinner bristles also can be recommended for kids. So in market you will be coming across mostly soft, medium and hard brushes. This extra soft, very tender gingival tissue, if it's there, extra soft is recommended. But in market you will be coming across either soft, which is recommended for young children. Medium mostly preferred. We will be using this medium toothbrush. So it is most preferred. And hard brush, sometimes if the heavily keratinized gingival tissues are there, then only hard brushes are recommended. But normally hard brushes are not recommended, and extra hard mostly not recommended. I never saw this extra soft or extra hard bristles actually. And coming to the length of bristles for an adult toothbrush, it should be the length of bristle will be around 0.406 inch, whereas kids toothbrush bristle should be 0.344 inch. So it will be slightly, the length of the bristle will be slightly smaller in kids toothbrush. Okay, so these things you might come across in viva and even as in MCQs during any entrance exam. And two types of bristle materials used in dentistry are the natural bristles from hogs. Hogs, I have already told you that it's nothing but domesticated pig. So the hair of this hog is used in making of this natural bristles for toothbrushes. This is actually the natural bristles made of hog. And artificial filaments of nylon, that is commonly used. We will be using this commonly. And the size of the toothbrush head. So the size of the toothbrush head as recommended by the American Dental Association is the length of the head. Head is should be 1 to 1.25 inch, that comes around to 25.4 to 31.8 mm, whereas width should be 5 by 16 to 3 by 8 inch, that is 7.9 to 9.5 mm. And the brush head should have 2 to 4 rows of bristles and 5 to 12 tufts per row. So coming to the power toothbrushes, this I think you might have used these power toothbrushes. Uh, I dreamt of using I dreamt of using it, but I actually made my children use these power toothbrushes. So power toothbrushes, no much difference. Studies have pointed out that the efficacy of a plaque removal, there will not be much difference between any power toothbrush or manual toothbrush. But coming to the cost involved in power toothbrushes, cost is too much for a normal middle class person to invest on. So even the problem is with the replacement of the heads. And some I felt the cost involved will be the major hindrance for usage of these power toothbrushes. But the main thing that differs is the interest of a child in brushing the teeth. So power toothbrushes, whenever you buy any power toothbrush for a kid, what happens? He feels as if it is a toy and he enjoys brushing actually. So that is the most positive point involved when you introduce a power toothbrush for your kid or any child. That is the main advantage. But there is a there is another problem involved that I will be talking about in the further slides. These power toothbrushes actually they are not new, and they were introduced in 1939. It's very long back. And these brushes actually previously they used to have the back and forth motion, and subsequent models more advanced motions like circular, elliptical motions and combinations came into role. And current electronic toothbrushes have oscillating and rotating motions. And what I have seen current the power toothbrush is the last thing, that is oscillating motion will be there. And this is what I want to concentrate on or want to tell you is the Haverton effect. This you might get it as a 2 marks question and Viva, important Viva question for you people. Haverton, it is not exactly related to brushing. It is an effect that has been proposed by Kurlinger. The main concept behind this effect is actually anything if it is a new, we tend to use it more. Say, for example, we bought a new phone. So, what happens? We try to just explore that phone day, night. Whenever you get free, you will be trying to explore things, new things in the mobile. So, you will be using the mobile more frequently than actual. The usage time will increase automatically. And say another example, kids example, if you buy a new toy for a kid, what happens? The child will non-stop 24 hours he will be keeping the toy with him even during sleeping he will keep it beside the pillow or even beneath the pillow and sleep because he wants to his toy to stay with him for 24 hours. But as the days go 10 days, 20 days, 30 days, he will not have the same interest on the toy as he was having on the day one. So this is nothing but Haverton effect. So this effect, if we apply it to the power toothbrushes, the same effect you can see. If first day of buying a power toothbrush, what happens? The child definitely shows interest in brushing his teeth. But what happens after a few days? He will lose that interest. So initially the child will be very curious and he will be very interested to use the power toothbrush. But later what happens? There will not be much difference between normal brush and a power tooth. He loses that kick in it. So automatically what happens? The tendency to brush the teeth with a power toothbrush will be the same after a few days, so it will be same. So plaque removal effect will also be the same. That is nothing but the Haverton effect by Thallinger. This you might get it as a 2 marks question. So definitely you have to remember this effect whenever you get a question. You have to write about this. And powered brush with acoustic energy. Acoustic energy, I think you will be knowing this. Acoustic energy is something in wavy fashion. There will not be any contact between for our power toothbrush. Actually, what happens? The bristle will come in contact with the tooth structure in order to remove the plaque. But with the acoustic energy, what happens? The bristle exactly will not come in contact with the tooth surface, but what happens, the movement of the bristle leads to certain disturbance in the, there will be a certain disturbance in the fluid which leads to some energy generate, there's some energy will be generated which leads to movement in the fluid which removes the plaque. That is nothing but acoustic energy. So nowadays the power toothbrushes are coming with this acoustic energy. Sonic thing will be there. If it is there in the name, automatically it implies that it is a powered brush with an acoustic energy. So it is proposed as a betterment of or there will be more plaque removal with these toothbrushes, but studies have to see what is the exact difference between they can compare actually manual toothbrushes with these power tools. Some studies are there which have pointed out that there will not be much difference between the plaque removal efficacy of a normal brush and a power toothbrush. And next thing that comes to our brain whenever we think of mechanical plaque removal is the dentifrice. Dentifrice is nothing but toothpaste which is used in a daily. We will be using this toothpaste whether fluoridated, non-fluoridated or any herbal. Mostly they will be non-fluoridated. So any dentifrice we will be daily using this dentifrice. So dentifrice is a substance used with toothbrush or other applicator to remove the plaque, dental plaque material, bar debris, stains from teeth, tongue, and gingiva for cosmetic, therapeutic, or preventive purposes. So, dentifrices are available in the powder form or a paste form. Powder form, they used to be in, even some people they feel comfortable with the powder. Even nowadays, some people they tend to use this powder. The powder contains abrasives. Actually, abrasive content will be more in powder, so it's not recommended to use this powder. So abrasives, detergents, flavoring agents, and sweeteners will be there. But when it comes to paste or gel form, they come additionally contain binders, humectants, preservatives, water, and coloring agents will be there. And coming to toothpaste for a child point, I mean, when you're using a toothpaste for any child, the main thing that you need to focus on is the whether it is fluoridated or non-fluoridated. That is the first point. Mm, and then what is the ppm of fluoride present in the dentifrice. So these 2 points should be in your brain whenever you are prescribing any toothpaste for a child. So age of a child and what paste you are recommending, these two things play a major role. So you might be coming across few toothpaste specifically manufactured for children. If you deeply think about why you have to prescribe a special paste or child formula dentifrice for a child, is that if you observe these things, Current, this is commonly available in the shops. This ketodent actually contains fluoride content. If you observe, it will be around 500 ppm. So 500 ppm is the one thing, and xylitol is another thing. So xylitol is a sugar substitute, so artificial sweetener it is, and which can't be metabolized by bacteria. That is an additional benefit of prescribing a ketodent for a child. And fluoride content of normal paste that we use, that is Colgate, Pepsodent, any adult toothpaste, it will be around 1000 ppm. So if you observe these pastes, all these pastes, they are having half the ppm of the adult toothpaste. So if you have another point you need to remember in your brain is the whether the area is a fluoride deficient area or optimal fluoride content is there in the water in that area, or under fluoride. So fluoride content of the water in that area also plays a role in prescribing a paste for a child. So it is a complicated thing, but you need to remember that the fluoride content of water in that area, that in view, if it is a optimum fluoridated area or under fluoridated area, you can give these space to the children. And first, if the child age of the child is below 6 years, I can tell you that it's better to go for a child formula dentifrice, because the amount of fluoride in these space will be less. This is advantageous because most of the young children below the age of 6 years, the tendency of swallowing the paste will be more. So if it is 1000 ppm, this swallowing of paste can lead to additional systemic fluoride content will automatically increase. So in order to skip this, you can safely prescribe child formula dentifrices. And the amount of paste that you prescribe for a child is also very important. If the child is below the age of 2 years, you can recommend a smear layer of paste on the toothbrush. So smear layer is just applying a small layer of paste on the toothbrush. And if the age of the child is below and between these 2 to 5 year old, then you can, mostly 3 to 5 year old, then you can advise the parent to use pea-sized amount of paste on the head of a toothbrush. So the amount of toothpaste used, what toothpaste you are giving for a child, is all should, you should be very cautious while you are giving even a prescribing a paste for a child. And another point, a very important point, is replacing the brush. So toothbrush, it should be replaced every 3 months, and if you feel that the bristles are not good or worn out, then it's the time to change the brush. So you have to advise the parents to use the right quantity, right type of paste, right quantity of paste. And maintaining the brush is also very important when it comes to mechanical plaque removal or mechanical plaque control. So these are the common child formula dentifrices you come across in the market, that is Kyodent, Cheerio Gel, Pepsodent Kids, Colgate Kids, whatever it is, it will be actually it will be having less fluoride content when compared to adult toothpaste. Sorry. So I will be stopping here. In the next class, I will be telling about the dental floss and other mechanical things that you use for mechanical plaque control, and then the brushing techniques, a small discussion about the brushing techniques, and then the detailed brushing techniques you have to cover them in perio, and then chemical plaque control measures. So this that will complete the plaque control measures in pediatric dentistry. Thank you.